Good morning. It's time to get in touch. Brought to you by Geisinger, Muncie, and Jersey Shore. State-of-the-art healthcare close to home. Every week, this public affairs show shines a spotlight on people and programs in our communities that improve the quality of life in Lycoming County and beyond. I'm Freddi Hammer, host of In Touch and news director at Backyard Broadcasting. October is Breast Cancer Awareness Month, and it's a time to highlight the importance of early detection, knowing your risk, as well as staying proactive about your health. Joining us this morning is Rebecca Vanderveeken. She's a breast surgery nurse navigator at Geisinger, Muncie, and Jersey Shore, here to talk about why screenings and risk awareness can make such a life-saving difference. Rebecca, thanks so much for being here today.
Oh, thank you so much for having me.
Absolutely. Well, we want to just know, how common is breast cancer? What are the current recommendations for screening? What should people do at what ages?
No, of course. So breast cancer, 1 in 8 women will be diagnosed with breast cancer, or it comes out to about 12%.
Okay.
The current screening recommendations for women of average risk would be annual mammograms starting at the age of 40.
Okay.
Now, that's where it also gets a little bit kind of deeper, because then they say if you are above average risk, you can begin earlier with mammograms and even supplemental imaging in addition to those mammograms.
Okay. I hear that some of my friends talk about the tissue is a different density, and there's different reasons for that, and that's where people may have to get more of a proactive screening at an earlier age.
So breast density is not so much a risk factor in itself, but it does make imaging a little bit more challenging. The best analogy I ever heard is if your breasts are really dense, it's like trying to find a polar bear in a snowstorm.
Okay.
So, dense breast tissue does make imaging a little bit more challenging. Dense breast tissue is more common in younger women, and typically as we age, we lose our estrogen, which then also affects our density and our fat and changes a lot of things. So usually as, women do age, the breast density does go down. Most mammograms, thankfully, these days are what they call 3D mammograms or tomo mammograms, and they are really designed to kind of see through that dense tissue at a better level. And, our radiologists, I think, across the board are excellent in that if they're doing a mammogram and they notice a woman is really dense, they will make that recommendation of, hey, maybe we should consider an ultrasound or an MRI or something else in addition to this mammogram to make sure we're not missing anything.
I see. That makes a lot of sense. Well, you talk about early detection. So what is the survival rate when breast cancer is found versus later stages of finding it?
So overall, if you consider all stages of breast cancer, the overall 5-year survival rate, it comes out to 90%.
Okay.
But we have two really big extremes there, because when it is caught early and it is considered a stage 1 or a stage 2, you are looking at a survival rate as high as 99%.
That's
which
great.
Is probably as good as you can get it, because I don't think nothing can ever be 100%.
Sure.
Unfortunately, when it is found to the point where it has progressed through the body, what we would call, stage 4 disease, metastatic disease, that is when the survival rate does drop, because unfortunately at that point it's not curative, but it is manageable to kind of prevent it from spreading, work on shrinking what we have, maintaining a quality of life. But even patients at that point can live anywhere from 3, 5, 10, even 15 years after that diagnosis of advanced breast cancer.
Absolutely. It's wonderful to hear the survival stories and the ringing of the bell and the wonderful things that come with that.
I love it, yes.
And so you're talking about the 1 in 8 women diagnosed with breast cancer in their lifetime. And what do you say to people who think, oh, I'm not, I'm one of the 7? You know what I mean?
And so, of course, because we never think it's going to happen to us until, God forbid it does. I usually tell women, because I speak to a lot of women that will say, well, I don't have a family history. I never smoked. I have a healthy life. And unfortunately, the two biggest risk factors for getting breast cancer are simply being a woman and getting older.
Okay.
So, because it is the most common breast cancer, amongst women. It, very is easy to think that, it may not be us because we don't have that family history and we have a healthy lifestyle. But unfortunately, as a woman, especially once you hit the ages of 60, that really is when it becomes most common.
So there's a personal level of risk that we have to take responsibility for, I'm sure. And so we can't help ourselves getting older. What else can we do to kind of keep those risks from being down a little bit?
Exactly. So, I mean, I think so many of us, I think, would love to okay, let's pause the clock here. But
yes.
we can't do that. We can't change getting older, and we can't change our family history if we have one. But there are a lot of modifiable risk factors. Smoking and alcohol, are tied to, so many problems and cancers across the board,
sure.
But they are both tied to breast cancer. So maintaining a healthy lifestyle when it comes to, alcohol moderation, not smoking, having a healthy diet. Weight is also a big influence with breast cancer, which we usually don't think of. And to be honest, it's not something I even took into consideration until I was in this role. But maintaining a healthy weight and an active lifestyle is important because unfortunately, as we, get up there with weight, that can increase your risk of breast cancer as well.
You talk about the genetics, though, of it. It's not all cancers are genetic, but genes, how do they play a part in this?
That is something most people think if, God forbid, they get that call that they have it. It's, oh, my God, I don't have a family history. Mm-hmm. The majority of breast cancers are not tied to any sort of genetic predisposition. There are some genes that do play a role in this. Unfortunately, most women, I think even just the general population, the BRCA gene is the one people are most familiar with. It seems to be the most popular one out there. Oh. But there are even up to 70 genes out there that can increase your risk of breast cancer. So it is crazy. The amount, so many times we even see a patient who's like, well, I had BRCA testing, but it was negative. Well, you very well may be negative for BRCA, but you may carry one of these other genes that we are even still learning about. Like this is a field that's so constantly evolving. So there's a lot of genes beyond that BRCA one that can predispose you to breast cancer.
It's just as fascinating to me that they must have just found all this stuff out in research. How exciting for researchers to learn about all these different things that we didn't have any idea about before.
I know it's constantly one of those things, honestly, where even if we have a patient who had all 70 genes tested negative, if it was over 5 years ago, we're probably going to say maybe you should meet with genetics again because it is a field that is so rapidly evolving and changing. They find new things all the time.
Okay. I'm wondering about the different, when you go into those little non-standard things, are there special tests that are different from a mammogram?
Yes, there are. So when we do have our patients who are high risk, unfortunately carrying a gene or maybe not carrying a gene but still having a strong family history, okay, that's when we do take into consideration early screening as well as supplemental screening. So when you are considered high risk, which 20% is technically like the black and white benchmark of when they say, okay, you're technically high risk.
Okay.
If you are over 40, that's when we would do your mammograms, but we also alternate them with a screening MRI.
Okay.
Then we would recommend starting mammograms as early as age 30, in addition to the MRI.
Okay.
And even women in their 20s, if you're over the age of 25, we would not utilize a mammogram, but we would use a screening MRI yearly until you hit 30 and then add that mammogram in with it.
Is it about self-exams then, too? I mean, you're into that space where you're maybe not knowing if you're having an issue or getting tested is a good idea for early detection. But really, self-exams are right in there as well.
Yes, and I mean, so many from like a clinical data standpoint, that's, believe it or not, that's something that's always changing. It's like tell patients to do self-exams, tell patients to not. I think the biggest thing is knowing you're normal.
Okay.
And, breasts can change with, pregnancies and hormone fluctuations. And especially if you are perimenopausal, premenopausal, your breast tissue is going to change a lot throughout the month. It's affected by so many things. Mm-hmm. So you want to make sure when you are doing an exam, it is at the same time, because maybe you get lumpy bumpy right before you get your period, and that's normal for you. Or, now it's after your period and this is how your breast feels. So it's important to have it consistent at the same time each month. So kind of those hormonal changes can be taken into consideration.
I've had a provider before say if it's on one side, it should be on the other. Is that true?
Yes. Yes, absolutely. So, and that's such a good point, because if we worry more so if you notice a change, okay, both breasts kind of feel a little lumpy bumpy, that, can be normal dense tissue. But when you feel something new, especially only on one side, that does raise an issue of concern.
All right. Well, certainly want to keep our mind on that. And, just being in communication with a provider or a nurse, being able to kind of talk with your family about it and kind of keeping it all out in the open so it's not a secret.
Absolutely.
I love that. Well, you're talking about all the different research and things, as well as the money that's being raised with the walks and stuff like that. Would you say that that's really what's caused us to know so much more about cancer research and breast cancer in particular?
Absolutely. I worked with a surgeon once, and I will never forget it. She was a surgical oncologist and worked with all cancers, and she would routinely say, if you have breast cancer, that is the best cancer to have.
Okay.
As strange as that may sound, and it is because it is something that is so well-funded, so well-researched. We are always learning more ways to screen it and catch it. So even if, maybe we can't cure this, but by doing all these new screening and knowing high-risk screening, we can catch this when this is super early, and you're at that 99% survival rate.
That's wonderful. What about men? I mean, you have this sort of area where men are sometimes getting breast cancer, low numbers, I'm thinking, but it still happens.
You're absolutely right, and that is something that we do overlook. 1% of breast cancer cases typically are male patients.
Oh, wow.
In my facility, we honestly usually see 1 or 2 men a year, which, I mean, that does kind of shake out, because if we see like around 150, 200 patients, then that does make sense. Okay. So it is now usually in men, it is often tied to genetics. So typically, if we have a male breast cancer patient, the first thing we're doing is having him meet with genetics, or even if we have a patient who mentions a history of male breast cancer, we often have her meet with genetics too.
Well, that's amazing, because then you sort of know what avenue to go down, right? I mean, you're sort of in that same spot. That's good. Are people nervous about mammograms? I guess I have to say, as a person who has, like, just in the past 5 years started mammograms, I was really nervous, thinking it would hurt. But it doesn't. It's really probably that's the biggest misconception.
I wholeheartedly agree, because I'm in the same window as you, and I know so many people that are like, oh my God, I don't want to get it. It's going to hurt. It's going to hurt. It's going to hurt. And then you go, and it's truly is not that bad.
It's like 2 file folders.
Right. And all mammogram techs are so wonderful, because that is what they're especially trained in, so they know how to do it in, a gentle fashion. And it truly is not that bad. And, even if, God forbid, it is uncomfortable for a few minutes of discomfort, you can be, really saving years of your life if, God forbid, something is caught.
I'm wondering about getting a mammogram. Does it cost a lot of money? I know that I can go and get my mammogram done kind of on a yearly thing with my insurance, but is that an option for people who don't have insurance? So
screening mammograms are zero cost out of pocket, whether you are insured, underinsured, or uninsured. Okay. So any woman, and honestly, technically, it does get a little bit hairy, but a patient can even get a mammogram even if she doesn't have a doctor. Okay. I mean, every facility kind of has a different protocol that they work with. If a patient calls and is like, well, I don't have insurance, but I need a mammogram, they often have different resources they go to. But, screening mammograms, no matter whether you have insurance or not, or what kind, that's absolutely covered. Then are there places that you can reach out to, or like nonprofits that offer this, or is it just through the Geisinger system we can contact a person through the phone number? So I know Planned Parenthood is an organization that does do a lot with breast health as well. Mm-hmm. I know within Geisinger we have like a contact. It's called the Healthy Woman Program. I'm not sure geographically how far that extends, but she's usually the contact for radiology, because she can kind of set patients up with resources to offset the cost of, God forbid, that screening imaging shows something and she has to go back. Sure. Really helping her down the line if more is needed too. Has that technology really improved with the screening itself? I mean, the different kinds of screenings you said that you can go through. I mean, the high-tech stuff is probably really cutting edge. I mean, it really has, and it also is even a field that still is even evolving. We're now, AI, such a topic everywhere. AI is starting to get incorporated with radiology, not in, substitution of, but kind of in supplement to. So you have a live person looking at it, but then you also have AI looking at your imaging. So really making sure 2 sets of, technical eyes are really reviewing everything. So that is something that is constantly changing. I can see how AI could be a help, because the 5 things that doctor may be familiar with may not be the 6th thing that they're familiar with, right? Absolutely. Yeah. Training has to continue too, but, it all helps each other. That's wonderful. Well, can you tell me a little bit your interest and your love for this career? Is it something that drove you just personally, or is it something that was something a little more personal that made you get into this career? So, I mean, I did lose both of my parents to cancer. Oh, I'm sorry. Not breast, but so I think that is kind of why oftentimes I can be a little bit more I don't know, touchy-feely at times because I can understand being on the caregiver side of things or seeing somebody you love go through that. But actually, before I was in this role, I was a critical care nurse for years, and I always wanted to work as a navigator. And I'm like, oh, breast, well, we'll see how this is, because it was completely different from what I was used to. And it was something I fell in love with. I, ended up going on to, earn certifications. And it is, now it is something I am deeply passionate about and I do enjoy.
Well, I can hear it in your voice, Rebecca, that you love this work and you're doing great things and helping patients. Tell me a little story about someone you know who was treated early, diagnosed, and then successfully beat the breast cancer. Is there something that sticks out in your mind that's extra special about that? Of course, all treatments and recoveries are special, but is there anything that stands out in your mind, Rebecca?
Absolutely. She is my favorite patient to talk about.
Okay.
I'll just first name only. Her name is Melissa. And when she was diagnosed, she was only 37. So she was under 40. She had no family history. She felt an area, told her doctor, had imaging, got called back for the biopsy, and unfortunately, it was a breast cancer. She had surgery. She had chemo, and she recovered successfully. And this was probably about 6 years ago.
Okay.
What I love about Melissa's story is that when she was all done her treatment, she actually, and I know this, not everyone can do this, she left her job and went into cancer advocacy and volunteering.
Wonderful. Sort of paying it forward.
And now every day she works with patients that are newly diagnosed, helping them, through this from like a psychosocial standpoint, getting them connected with resources, and she serves as that resource. And I love that because she can tell that firsthand, which is a lot different. I tell patients from me telling you because I'm not in that position, but she was, and she went through this. She's the beacon on the hill, knowing that she can do.
Absolutely. You can do it too. the golden light on the top of the hill for sure. Well, on the other hand, what if for families who have maybe lost someone to breast cancer? What's the information that you would give to them about during Awareness Month? I'm sure that's a difficult time.
Absolutely. It can be very challenging. And honestly, even for some of our, survivors, everybody perceives that October Pink Month differently, and some survivors can really embrace it and run with that. And some it may be, very upsetting, kind of bringing back those memories of having to go through that. And I think if that is, the category, I think it's also important to, really vocalize that, share that story, even make that known to your close family and friends. Okay, well, why aren't you going to the walk, or why don't you want to do this? And really explain, like, well, to me, it just kind of brings back everything, rehashing what, my wife went through, or rehashing what I went through. And I don't want to, go back through that era. And there's so many other ways to keep that memory alive. And even as a survivor to help, I mean, you can still donate and volunteer without having to go out and do any of those events.
Sure. Locally, there's a lot of places that are here to support families going through breast cancer who may be in remission. You have Girls in the Hoodie. You have folks donating books to the Hillman Cancer Center, where all that support's going on. Do you have anybody else or any other organizations that provide that sort of support?
I mean, on a large scale, American Cancer Society, Susan Komen Foundation, and even each state within themselves often has a very strong breast cancer coalition as well that really helps to drive that support, raise those funds, and even distribute them, as needed.
Sure. We're just sort of mentioning those local organizations, Girls in the Hoodie, where, have you heard about them? They give away free hoodies to people who may have the chemotherapy that get cold a little more often, so they'll provide those pink hoodies for folks.
That is so wonderful. I love that.
Yeah, you can find that on Facebook, Girls with a Z, Girls in the Hoodie for sure.
Thank you.
Yes. I just want to know how much encouragement you could give us about people who may be going through this, or maybe they're overdue for a mammogram, they're a little nervous. What would you say to somebody who's like, it's time to go? You're 53, you haven't had a mammogram, maybe it's time. What would you say to them?
So first off, I'm going to say you're not the only one. So there are so many patients out there that, put it off, or maybe they went for one and then got off track and didn't. So, I don't want anyone thinking oh my God, I'm the only one. Nobody's going to judge you. So if it's the kind of, oh God, they're going to think I put this off, I don't care about myself. These techs are not looking at your schedule for the past 5, 6, 7 years, and if you were, compliant. They're looking at the person in front of them today, and we're going to do your study. So nobody's going to be looking back and paying attention to that. No one's going to be judging that you didn't come last year or the year before, or ever for that matter.
Sure.
And you're also not the only one that didn't go or fell off track.
It's better to know than not to know.
Absolutely.
Well, we are just thrilled to have you here to talk about Breast Cancer Awareness Month. What other kind of things, is there anything finally that we want to make sure that we remind people, and maybe some organizations and that get more information about screening guidelines or their risks?
Absolutely. So I think knowing your risk is huge. So if you have a family history and you're wondering like, oh, geez, am I high risk? Do I need that extra imaging? Definitely talk to your family doctor or your OB, because they can certainly connect you with the right avenues to determine if you are high risk or not. Because knowing that risk is going to make sure that you're getting the appropriate screening. I think as far as resources, American Cancer Society is kind of like the gold standard. Their website has excellent outline of screening for breast cancer and every type of cancer, to be honest, on regular risk, high risk, all the different modalities, and also all these facts and figures of how common it is, and even across all demographics. Susan Komen also is an excellent site. They have a lot of information, especially for younger patients, and they have a lot of information about patients that might be of higher risk as well.
Well, it's just been fascinating to learn about all these different avenues that we can take to make sure that we can be screened early, men and women, of course, if it's something that's on our mind, can talk to our doctor, know our family history, and really schedule the mammogram. That's really the first step, isn't it, Rebecca?
That's the most important thing.
Well, how can we get in touch with you or your team so that we can make sure that we can continue to receive treatment if needed?
So really, if you can just go to Geisinger.org, it can put you into connection with all of our different sites, because we are a very large health system.
Okay.
And that's where you can find whatever site may be closest to you. You can also even search breast on the main website, and that will even take you to ways to kind of learn about your risk. Are you high risk? Put you in connection if you're curious about that, and even just go over common breast problems, cancer-wise and also benign.
Wonderful. Rebecca Vanderveeken, she's a breast surgery nurse navigator at Geisinger, Muncie, and Jersey Shore. We just appreciate you being on the job. Thank you so much for being with us today on In Touch to talk about Breast Cancer Awareness Month.
Thank you so much for having me, Freddi.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us for questions, comments, or topic ideas, call weekdays 570-323-8200 or email me at fhammer@backyardbroadcasting.com. For archived files of our In Touch shows, find our Backyard Podcasting link on any Backyard Broadcasting website, or subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch. Brought to you by Geisinger, Muncie, and Jersey Shore. State-of-the-art healthcare close to home.